Hey everyone, Ryan here. Whether you're joining the dental workforce, you're interested in pursuing dentistry, or maybe you're a patient and want to learn about the different dental specialties, well, this video is designed to introduce the 10 current specializations in the field of dentistry in the US. So a specialty is an area of dentistry that has been formally recognized by the American Dental Association and its appropriate regulatory boards. The ADA posits that the needs of the public are best served if the profession focuses mainly on general practice and general dentists, but specialties are recognized in certain areas where advanced knowledge and skills are essential to maintain or restore oral health. So these are the 10 current dental specialties recognized by the ADA. So let's go through them one at a time. So dental anesthesiology is actually the newest of the group, and it was formally recognized on March 11th, 2019, almost exactly 1 year ago today. So from the ADA website, dental anesthesiology is the specialty of dentistry and discipline of anesthesiology encompassing the art and science of managing pain, anxiety, and overall patient health during dental, oral, maxillofacial, and other surgical procedures throughout the entire perioperative period. And the specialty is dedicated to promoting patient safety as well as access to care for all dental patients, including very young and patients with special healthcare needs. So this specialty is trained to provide pain management during dental procedures, particularly things like intravenous deep sedation and general anesthesia. A dental anesthesiology residency is 3 years long following dental school and focuses on proficiency in anesthesia delivery as well as emergency medicine and rescue. Dental public health is the science and art of preventing and controlling dental diseases and promoting dental health through organized community efforts. It's the form of dental practice which serves the community as the patient rather than the individual, and is concerned with dental health education of the public, with applied dental research, and with the administration of group dental care programs, as well as the prevention and control of dental diseases on a community basis. So dental public health has been an ADA recognized specialty since 1950, and it's unique because it's not primarily a clinical specialty, but rather its practitioners focus on dental and oral health issues in communities and populations. So things like social health policy, fluoridation of drinking water, school dental screening programs, and oral health in care homes and nursing facilities, all of these things are encompassed by dental public health. A dental public health residency is 1 to 2 years long following graduation from dental school. Endodontics is the branch of dentistry which is concerned with the morphology, physiology, and pathology of the human dental pulp and periradicular tissues. Those are tissues near and around the root of the tooth. Its study and practice encompasses the basic and clinical sciences, including biology of the normal pulp, the etiology, diagnosis, prevention, and treatment of diseases and injuries of the pulp, and associated periradicular conditions. So endodontics is all about saving natural teeth, because even an implant is not a perfect replacement for a natural tooth. The most common procedure that an endodontist is performing is a root canal therapy, where you clean out the infected nerve tissue of a tooth, as seen here, and replace it with a sterile biocompatible material. They also perform root surgeries and manage traumatic tooth injuries. Residency for endodontists is 2 to 3 years long following dental school. Oral and maxillofacial pathology is the specialty of dentistry and discipline of pathology that deals with the nature, identification, and management of diseases affecting the oral and maxillofacial regions. and it's a science that investigates the causes, processes, and effects of those diseases. And the practice of oral pathology mostly includes research and diagnosis of diseases using clinical, radiographic, microscopic, like seen here, biochemical, and other examinations. So this specialty is all about digging for answers, and diagnosis can range from something benign, like an aphthous ulcer, to something malignant, like oral cancer. Oral and maxillofacial pathology residency is on average about 3 years long. Oral and maxillofacial radiology is the specialty of dentistry and discipline of radiology concerned with the production and interpretation of images and data produced by all modalities of radiant energy that are used for diagnosis and management of diseases, disorders, and conditions of the oral and maxillofacial region. So oral radiologists have advanced training in radiation physics, biology, safety, and hygiene, which enables them to study and interpret X-ray images from routine bite wings to magnetic resonance imaging, or MRIs, to three-dimensional cone beam computed tomography images. So oral and maxillofacial radiology residency is anywhere from 2 to 3 years long. Oral and maxillofacial surgery is the specialty of dentistry which includes the diagnosis, surgical, and adjunctive treatment of diseases, injuries, and defects involving both functional and aesthetic aspects of the hard and soft tissues of the oral and maxillofacial region. This is certainly a very demanding but also rewarding specialty. It routinely involves extractions, implant placements, and surgery of the jaws, but surgeons in this specialty diagnose and treat a wide range of conditions, including cleft lip and palate, facial injuries, and head, neck, and oral cancers. Residency programs for oral and maxillofacial surgery are the longest of all the specialties, clocking in at 4 to 6 years long after dental school. So the oldest of the recognized dental specialties, founded in 1900 by Edward Engel, is orthodontics and dentofacial orthopedics. This is the dental specialty that includes the diagnosis, prevention, interception, and correction of malocclusion, or a bad bite, as well as neuromuscular and skeletal abnormalities of the developing or mature orofacial structures. So orthodontists help create beautiful smiles by straightening teeth and also sometimes modifying maxillary and mandibular growth via orthopedic appliances like headgear. There's also a fellowship in craniofacial orthodontics focused on complex multidisciplinary care of congenital abnormalities or anomalies like cleft lip and palate, Pierre-Robin syndrome, Treacher-Collins syndrome, among other things. Residency programs for orthodontics are 2 to 3 years long. Pediatric dentistry is an age-defined specialty that provides both primary and comprehensive preventive and therapeutic oral health care for infants and children through adolescence, including those with special healthcare needs. So good oral health starts as a child, so educating kids and their parents and preventing disease early is much of the focus of pediatric dentists. Residency for pediatric dentistry is 2 to 3 years long. Periodontics is that specialty of dentistry which encompasses the prevention, diagnosis, and treatment of diseases of the supporting and surrounding tissues of the teeth and their substitutes, and the maintenance of the health, function, and aesthetics of these structures and tissues. So periodontal disease is the most common cause of tooth loss among adults. So this career is focused on preventing that tooth loss and promoting health of gums and bone that support the teeth. So periodontists can also place and repair dental implants. Residency programs for periodontists are on average about 3 years long. And our last specialty is prosthodontics, which is the dental specialty pertaining to the diagnosis, treatment planning, rehabilitation, and maintenance of the oral function, comfort, appearance, and health of patients with clinical conditions associated with missing or deficient teeth and or oral and maxillofacial tissues using biocompatible substitutes. So prosthodontists replace missing teeth with crowns, bridges, dentures, and the restoration of dental implants. There's also a maxillofacial prosthetics, which is a subspecialty of prosthodontics, which focuses on rehabilitation of patients with congenital facial or oral defects such as cleft lip and palate, or patients born with an underdeveloped ear, for instance. Or they can restore function and aesthetics for people who undergo resective cancer surgery or experience trauma from war to motor vehicle accidents. The residency for prosthodontics takes on average 3 years to complete. So on my channel, I have in-depth video series for nearly all of these 10 specialties. So you can search my channel for playlists that go into much more detail about each of these if you are interested in particular specialties. Other specialties out there not formally recognized by the ADA include forensic odontology, which involves gathering and studying dental evidence in law for solving cases, geriatric dentistry, which is dental treatment for the elderly, oral implantology, which focuses especially on placing implants, and veterinary dentistry, which is dental care in the treatment of animals. So there's lots of cool stuff out there in the world of dentistry, and hopefully you enjoyed this video and this introduction to the dental specialties and that you learned something new along the way. So that's it for this video, guys. Thank you so much for watching. Please like this video if you enjoyed it and subscribe to this channel for much more on dentistry. If you're interested in supporting this channel and what I do, please check out my Patreon page. Thank you to Michael Raja, Reb Boyd, Leonella Bunger, Zahir Anani, David Jaden, Isabella Caldas, Ali Benjir, Badir Hefnawi, and all of my patrons for their support. You can unlock extras like access to my video slides to take notes on and practice questions for the dental board exams. So go check that out if you're interested. The link is in the description. Thanks again for watching, everyone, and I'll see you in the next video.